backtrack this one. How has my mouth ulcer got bigger? So maybe how does a mouth ulcer get bigger?
Yeah. So to the question is how does my mouth ulcer gets bigger? Or like we said, do mouth ulcers get bigger? Yeah. So depending on the ulcer, right? So we call them either canker sore or we call them canker sores or man, I got a brain freeze here. Canker sores, for example, right? Okay, so you have a canker sore that happens in your mouth, and all of a sudden you start to see a big ulcer in your mouth. Sometimes I see these ulcers, they happen in the lip, like a very tiny ulcer. Sometimes they're as big as a quarter. So when when the ulcers start to happen, you may start to see that one ulcer happens right in your mouth, right here in your lip, and then all of a sudden, over a period of time, in the next few days, you start to see either the same ulcer gets bigger, or you may have the same ulcer that happens in a different part of the mouth, and it may be bigger than this size. So all of a sudden now you're starting to think, well, do mouth ulcers get really bigger? So you may be thinking it's the same one, but it could be a completely different one that starts with being a big ulcer. So the answer to the question would be yes, do mouth ulcers get bigger, or you may get a big ulcer to begin with, and sometimes the ulcers have a tendency to migrate from one place to the other. So simple fix, or maybe I should say the reasons that happens. It could be stress, or it could be some kind of a viral infection, or it could be some kind of you may have some kind of a immunocompromise. You're immunologically compromised. For example, you may have a cold, and you may be fighting a cough, and all of a sudden you start to have an ulcer. And what we normally see in our office, patients have some kind of an oral surgical or a periodontal procedure or a gum procedure done. All of a sudden they come back and say the week after, hey doc, I did not have a gum ulcer or a mouth ulcer when I came to see you, but now all of a sudden I have an ulcer. What's going on? Now your body has to handle all the stress, because you're now handling your body has to handle all the procedure. Now all of a sudden you're stressed out, your body is stressed out. Now all of a sudden these virus gets or the bacteria get activated in your mouth, and they compromise your immune system. Now all of a sudden you get an ulcer. Those are two different things. Not because you had the procedure that caused the ulcer, it's because of your immune power, your immunity. So a lot of times I normally tell patients, don't even worry about it, like it'll go away like after like about a week or 10 days. Sometimes patients say, well, can I apply the Oragel? I can buy it from over the counter. Yeah, go for it. Yeah, if it is going to help you, you can apply something to help you. Even if you don't, it should most of the time go away. Very rarely we give out medications to those patients to treat the ulcer, but most of the time it tends to go away.